Hello everyone, I'm Praveen from Group 4 of 3rd year 5th semester. Today, let's see what are the action we have to take when we see a patient with a hypovolemic shock. Before going to the practical part, let me explain you what is hypovolemic shock. Hypovolemic shock is a loss of blood volume which leads to decreased oxygenation of vital organs. As a result, the body's compensatory mechanism fails and the organ begins to shut down. The cause of hypovolemic shock is any condition which causes loss of circulating blood volume or plasma volume. It also includes hemorrhage, traumatic injury, or burn, which could lead to loss of capillary permeability and prolonged vomiting and diarrhea. The desired outcome will be the restoration of circulating blood volume, preserve of hemodynamics, and preventing any damages to vital organs. Now let's see the practical part of this video. Yo bro,
Hey there.
could you pass me the apple?
Sure. Wait, let me show you a trick.
Help! Rahul. Are you alright? Okay? Okay. Nothing. You don't worry. Okay? Just hold it. Hold it tight. Show. Remove this hand. Okay? Are you feeling alright? Okay? Come on. Okay. Just keep the hand like this. Okay, then. In this case, we have a patient who has a severe artery wound and we have helped him by putting the first aid bandage on his hand. And also we have helped him by laying down on the ground because he can feel comfortable. And then now we have to check whether he has a psychosomatic psychogenic shock which could have happened because he has seen a lots of blood, or he has lost enough blood which could have lead to hypovolemic shock. Either ways, the both symptoms are same and we will treat them. We have our gloves on and we have to check our scene safety is clear. The scene is safe. We will check whether the patient has a breathing and pulse normal. The breathing and the pulse of the patient is normal and he also has normal consciousness. But since I have been noticing the patient is having pale skin and he has started to lose somewhat consciousness, it is the time to call a medical emergency by calling the ambulance. Someone call the ambulance. It's the time we begin the treatment. I will reassess the breathing and the pulse of the patient. Though I have seen the pale skin, I will first squeeze the nail bed of the patient and turn it into white. It is clear for it. It has been taken longer for me to say that the capillary refill is somewhat slow, which means it's a sign. It is a sign of potential shock. Now I will explain the patient what we are doing. For that we must need a stool or something to elevate the legs of the patient about 5 to 6 inches long. Now here I found a dustbin which we can use to elevate the patient's leg. Here I have a blanket to cover the individual's body. If you don't have a blanket, you could use a newspaper or any kind of clothes to cover the entire body of the patient. To maintain the body's temperature to the normal, because during the shock the body will try to shrunk the blood from the extremities and send it back to the vital organs. This makes very cold to the peripheral. When this happens, the body will take longer before it thinks it has to reheat the whole body, which may leads to dilation of blood vessels and sudden decrease in the BP. We have to fight this by keeping the body's temperature to its normal, by covering the body whole with a blanket or something. If there is some changes in the body, like a droppage in breathing or a droppage in pulse, we have to immediately fight them by using CPR, or we have to wait until the EMS is arrived.